Greetings, Dr. Mark Winton here from the University of Central Florida Department of Criminal Justice, and in this video I'd like to talk about futurist studies and drugs and crime. Futurists basically are people who are interested in understanding, predicting, projecting the future, setting up scenarios to make things better, looking at the challenges that we face, and a lot of this information is in futurist studies and the futurist, and there's a international organization of futurists who publish a journal as well as a magazine and all kinds of other materials. And in the futurist magazine they would have a segment where they talked about changes, and they looked at 6 areas: demographics, economics, healthcare, therapy, cultural values, technology, and ethical issues. And I think one thing to do here is to go ahead and to apply these areas to our drugs and crime course. So let's briefly go through some of these areas in terms of thinking about the future. 5 years down the road, 10 years maybe, 25. First, let's look at demographics. And instead of coming up with these statements of what is or what will be, we're going to look at what we need to study, how we should maybe go about it to reach a variety of conclusions and predictions. So with demographics, we're looking basically at the makeup of populations. And so we might ask how the changing demographics in the United States will be related to drugs and crime. So are there certain age groups that are more likely to use certain drugs, or least likely? Are there different views and attitudes that age cohorts have toward specific drugs, and also their ideas about what we should do about drug problems? For example, in terms of rehabilitation versus punishment or something in between. So looking at the demographics is very important. Second, we can look at the economics, and that's a huge discussion because we start talking about the profits and the money that's generated from the illegal sales and distribution of drugs, but also we can take a look at the profits that are obtained through pharmaceutical companies with legitimate drugs marketed and sold throughout the world. And we can also look at what can happen or what might happen in regards to changes in drugs. For example, if marijuana becomes legalized and is taxed, how will that change certain areas where that increased income comes into, the county or the state or whatever, the case might be? What are going to be some of the future costs that we're going to see related to drugs and crime in terms of healthcare costs, therapy, rehabilitation, also the criminal justice system, the court system, policing, corrections? How is that all going to come together there and related to the economics? We only have a limited supply of funding, and where are we going to put that funding? What percentage do you think should go to criminal justice versus healthcare? How do we divide up what we have? And so that's going to be a discussion that we continue to have, and we already have that discussion going on now, and it obviously will continue. The third factor relates to healthcare and therapy. So here we might ask what kinds of therapies will be available in the future for the treatment of substance use disorders. And obviously a lot of this will be related to advances that are made in healthcare. And for example, we may see new medications developed to treat the abuse of other medications or substances. we might find that there's new methods of therapies that may be used that are effective in treating substance use disorders. The fourth factor, cultural values, relates to how cultures view drugs and crime. So a lot of this has to do with the different values or importance that groups give to specific drugs, and their ideas about how they conceptualize or understand crime and what should be done about it. And then the fifth factor, technology, is extremely important as well. We've seen so many rapid changes with technology, but what do you think is going to happen in the future? I mean, for example, there's been a huge increase of telehealth, teletherapy. So a lot more people have been getting, especially due to COVID, their psychotherapy in the online environment through teletherapy, and also telehealth as well. For example, I had a telehealth session with the nurse practitioner at the practice I go to, and we connected up using whatever system, kind of Zoom system, if you will, at her office, and I thought I had a sinus infection, and she interviewed me, talked about my symptoms, and prescribed appropriate medications to treat sinus infection. So, and I never left my house, and that seems like a very effective way for many situations. What's nice about the telehealth, especially when it comes to treating and intervening and helping people that live in rural areas that may not have as much access, or in other locations and just can't get into a facility. So there's a lot of discussion about the benefits, just like working from home, basically, in that sense. Also, there's new apps that have been developed to help those that have substance use disorders, and we're probably going to see an expansion of that, newer technologies as well. And all this is going to be integrated in a sense, the demographics, economics, healthcare, therapy, cultural values, and technology. And the final factor that we have there are the ethical issues that we have to address related to drugs and crime. And one that I had in a previous video had to do with the ethical issues about the prescription databases, and what happens when they're misused, or when there's errors or biases. What are the ethical implications? What are the ethical aspects of what we do regarding someone who has a substance use disorder? What are the ethical parameters? How do we have these debates? What does it mean to do no harm? What does it mean to provide services and care? What does it mean to maintain confidentiality? What does it mean to provide funding for services, and so on? And so we get a lot of ethical issues as well. Especially new ones come up related to technologies. I took a course over the summer on teletherapy, and it was a lot more than I anticipated. I thought it was like Zoom. You just log on and you have your counseling session, but there's a lot more that goes into that regarding privacy, HIPAA, and note-taking, making sure that the person that's on the other end is the actual person they're supposed to be. There's rules and regulations regarding if someone can counsel someone who's in another state or not, and if they have to be licensed in that particular state, and so on. So a lot of rules, regulations, note-taking, all kinds of issues. But I think that's obviously, I was going to say that is really the future, but the future's already here. The future's already here in that regard. And I don't think we're going to go back completely to the face-to-face in the encounters. I think there's going to, I mean, we're still going to have those, obviously, but there's also going to be a lot more telehealth and teletherapy. So think about how these factors all interrelate and work together or in opposition, and how we think about these factors related to drugs and crime, demographics, economics, healthcare and therapy, cultural values, technology, and ethical issues. And this wraps up this video. Thank you.